Today, we're going to talk all about circumcision. I receive a lot of questions like, is circumcision safe? Why should someone consider it? Or is it better to avoid it? So today, we're going to take a detailed look at the pros and cons of circumcision and whether it's truly beneficial or not. I'm Dr. Rena, a urologist and pelvic surgeon, and if you're new here, I create content about urologic health, bladder health, sexual health, and much more. So if you enjoy this kind of information, be sure to subscribe and share this channel with your friends. Today, we'll break everything down. First, we'll discuss the reasons someone might choose circumcision, then we'll go over the benefits and risks of having the procedure. We'll also cover some of the common controversies people mention, especially about the nerve fibers in the foreskin that gets removed. And we'll answer whether circumcision can affect your sex life. Finally, if you decide to go ahead with it, we'll talk about what you should expect. In this video, we'll focus specifically on adult circumcision. I won't be discussing circumcision in infants or babies, as this is centered on adults. So, why do people get circumcised? There are three main reasons. The first is certain skin conditions, such as lichen sclerosis, which can cause changes in the skin that make urination painful or difficult, often appearing as scarring or white patches on the tissue. The second reason is balanitis, which is inflammation of the foreskin that can sometimes become infected, often due to poor hygiene or difficulty pulling back the foreskin to clean underneath. Over time, this can lead to scarring, pain, and discomfort, especially if it happens repeatedly, making circumcision a reasonable option. Lastly, there's paraphimosis. This occurs when the foreskin is pulled back and becomes stuck, leading to significant pain because it acts like a tight band around the penis and restricts blood flow to the tip. As a result, the head of the penis can swell, making it increasingly difficult to move the foreskin back into place. This situation is considered a surgical emergency. If you're dealing with this condition, you need to go to the emergency room so we can try to reposition it manually, and if that doesn't work, then you'll need to go to the operating room so the foreskin can be properly returned, and in many cases, this may require a circumcision. Other reasons people think about getting circumcised include cosmetic preferences and also lowering the risk of infections like human papillomavirus or HIV. In fact, studies have shown that individuals who are circumcised have about a 60% lower risk of acquiring or passing on HIV to a partner. This is because there's less chance of small tears in the foreskin and less extra tissue where the virus can remain. Additionally, circumcision can almost completely remove the risk of penile cancer, since without a foreskin, the likelihood of developing this type of cancer is extremely low. So, what are the risks we discuss when counseling someone about circumcision? One is bleeding. In some cases, this can lead to what's called a hematoma after surgery, where blood collects under the skin, causing bruising and swelling. Usually, this improves on its own over time, and only in rare cases would someone need another procedure to reopen the area and control the bleeding. Other common concerns include dissatisfaction with how much skin was removed, either too much or too little, and changes in sensitivity. I've mentioned this in a previous video, but during the first 1 to 3 months, sensitivity can feel very different because the glans, which was previously covered, is now exposed. As a result, some people may experience heightened sensitivity after the procedure. The biggest concern I personally discuss with my patients is regret. You need to be completely certain that this is what you want and be prepared to accept the possible risks. Now, let's address the big question. Does circumcision affect sexual function? The most reliable data we have on how circumcision influences sexual performance, sensitivity, ejaculation, and orgasm, essentially everything people worry about, comes from what are called systematic reviews and meta-analyses. These studies analyze results from many different research papers that examine various aspects of circumcision. And in the most recent meta-analysis I reviewed, it found they evaluated sensitivity, sensation, pleasure, and overall function, and they reviewed 49 different studies. More specifically, they focused on what are considered high to moderate quality studies, meaning these were either systematic reviews or what we call randomized controlled trials. In these trials, participants are divided into two groups. One group undergoes circumcision, while the other does not. In fact, there have been two major randomized controlled trials conducted in Kenya and Uganda involving adult men, which means we can apply these findings to men who choose circumcision later in life. Another key feature of high-quality studies is that they have little to no risk of bias, meaning researchers carefully design them to avoid outside factors that could influence the results. For example, if one group that had circumcision also had high blood pressure and diabetes, while the other group without circumcision did not have these conditions, the results could be misleading. That's because those medical issues increase the risk of erectile dysfunction, which could make it seem like circumcision was the cause, even though it wasn't. So, when researchers analyzed these 46 studies, focusing specifically on the high to moderate quality ones, they found no difference in ejaculation, erections, premature ejaculation, sensation, function, or any other major concerns. Overall, based on the strongest available data, we can conclude that there should be no significant difference whether someone chooses circumcision or not. However, if you are considering the procedure yourself, it's important to understand that there is still a possibility of changes in sexual function, and being aware of that matters. Many people also mention that the foreskin contains a large number of nerve endings, which could influence the level of pleasure experienced during intercourse. In particular, some point out that these nerve endings are concentrated in an area known as the frenulum. When researchers have examined anatomical studies and looked closely at the nerve endings in the penis, they found that a specific type of nerve ending is responsible for erotic sensation, known as genital corpuscles. These corpuscles are located in the glands of the penis, particularly along the ridge of the glands. So when there is tension or pulling on the frenulum, it can feel especially pleasurable, which leads many men to believe that the frenulum plays a major role in erogenous sensation. However, when you examine the foreskin itself and study the nerve endings within it, they are actually quite similar to nerve endings found in other parts of the body. This means they respond to light touch, firm pressure, vibration, and temperature, just like skin elsewhere. So removing a small portion of the foreskin should not significantly affect your ability to experience erotic sensation. That said, even with the data I've shared, I don't want to dismiss the experiences of anyone who has had difficulties after circumcision. There are certainly individuals who report troubling symptoms afterward, and it's important to acknowledge that this can happen. Some people do have negative outcomes or regret following the procedure, and that deserves understanding and empathy. However, these outcomes have not been consistently supported in the medical research available on circumcision. If you decide to move forward with a circumcision, let's go over what you can expect when you visit a urologist. When you arrive, the process begins with preparing the area. It will be cleaned thoroughly with soap and water. Then, a sterile drape will be placed over you to keep the area clean during the procedure. After that, the doctor will administer a numbing medication. You'll feel 1 or 2 small needle pricks to numb the nerves supplying the penis. You may also feel an additional injection around the area to block another group of nerves. And after that, you shouldn't feel anything further. In fact, I've even had patients fall asleep during the circumcision procedure because the numbing block works so well. The procedure itself usually takes about 30 minutes, and afterward, you'll have stitches around the glands that dissolve on their own, so there's nothing you need to remove or take care of later. You'll also have a dressing placed around the penis, and your doctor will instruct you to keep it on for 1 to 2 days. One important thing to understand is that once you remove the dressing, the area may look very swollen and not very appealing, and that's completely normal. The swelling typically improves over the next 1 to 2 weeks. At home, you can use ice packs wrapped in a towel or even a bag of frozen peas on the area to help reduce swelling. Pain is usually not a major concern, especially on the day of the procedure, because most urologists use a long-acting numbing medication that can keep the area numb for about 6 to 8 hours. Once the dressing is removed, you can shower, and let soapy water gently run over the area, but you'll generally want to avoid soaking in a bath for about 2 to 4 weeks. Some urologists may also recommend applying bacitracin or petroleum jelly to the incision twice a day. Discomfort can typically be managed with over-the-counter medications like acetaminophen or ibuprofen. You'll need to avoid masturbation and sexual activity for about 4 to 6 weeks. If you experience an erection naturally during the healing period, that's completely normal and shouldn't interfere with recovery. During this time, you should also avoid strenuous activities such as heavy lifting, intense exercise, running, or weight training. When it comes to appearance and how much foreskin is removed, many people have questions. Some individuals have specific preferences and may discuss where they want the incision placed on the penis and how much foreskin they would like removed. Typically, the position of the incision is described as either high or low. Low meaning closer to the glands, and high meaning a bit farther away. The tightness of the remaining skin is also determined by how much foreskin is removed. So if it's tighter, that means more foreskin has been removed, and if it's looser, that means less foreskin has been taken away. Most urologists don't usually have a detailed conversation about this preference with patients. So if you do have a specific idea of how you want it to look afterward, it's important to discuss that with your urologist. However, you should understand that if the foreskin is made too tight, it can lead to pain or discomfort during an erection, or even make it harder to achieve an erection because the skin is too tight. On the other hand, if it's too loose, you may still need to retract the foreskin to clean underneath it, and during the healing phase, if that foreskin isn't kept pulled back from the glands, it can stick to it and form what we call adhesions, which may need correction later. Most urologists aim for a balanced approach. We want to remove enough foreskin so that you can have full, comfortable erections without pain, but not leave it so loose that it causes problems with healing. All right, I hope this helps answer many of your questions about circumcision. If you have more questions, feel free to leave them in the comments below. I'll do my best to go through them and respond to as many as possible. As always, remember to take care of yourself because you truly matter.